Good afternoon, everyone. Thank you very much for joining us this afternoon for the launch of the Digitally Enabled Circular Healthcare Innovation project. My name is Fiona Charnley. I'm a Professor of Circular Innovation at the University of Exeter and delighted to be leading this project, and also joined today by a number of colleagues from the universities of Cambridge, Exeter, Manchester and Sheffield who are collaborating on the project, and also several of our industrial partners. So in this hour-long webinar, we are going to be introducing you to the project and also hearing from some of the other speakers and partners. Just a couple of points for housekeeping before we get started. Please do keep your microphones on mute while speakers are presenting. This webinar is being recorded and will be available on the DECHI website afterwards if you want to share that with any colleagues or those interested who weren't able to attend today. If you don't wish to be included in the recording, please do keep your cameras off. However, we would love to see you if you do want to be in the recording, so please feel free to keep your cameras on. And then there'll also be time for Q&A at the end of the presentations. So please do either add your questions to the chat or raise your hand at the end of the session to come in and ask your question to the speakers. So as I mentioned, the agenda for the afternoon is to introduce you to the DECHI project. I'll be handing over to some of the workstream leads to give you a bit more information. We're then going to have a brief overview of the Design for Life programme from Josh Crosley from DHSC. And then we'll also be joined by Daniel Cool, who is Managing Director at Surgical Holdings, to give us a presentation on what circular innovation looks like in practice. And then, as I said, we'll have time for Q&A at the end. So I'll give you a bit of an overview of the project. It started this year in January, so we're 4 months in. It's a 3-year project. It is funded by EPSRC, so the Engineering and Physical Sciences Research Council, and includes lots of different partner organisations, all the way through from government. We have some key NHS trusts involved who we're going to be collaborating with, some manufacturers, remanufacturers, and also the regulators, ABHI and BSI, and other innovators across the medtech space and also the academic landscape. So it's really a programme that's packed full of stakeholders, which is really important for the application of this research. So really the vision of the project is to investigate how advances in digital technologies and digital approaches to research can accelerate our transition towards a more sustainable, resilient healthcare system of the future, predominantly using circular innovation. So it's really how can circular economy principles be applied to the healthcare sector in practice. And we're specifically going to focus on medtech within the healthcare sector. Our vision really looks at the tighter loops of circularity. So we hear a lot about waste, a lot about recycling, but actually some of our previous research that's been published has demonstrated that actually there's a lot of value in terms of environmental value and economic value that can be gained from focusing on those tighter loops of circularity, such as reuse, resource recovery, remanufacture and redistribution. So these are the areas that we're going to be focusing on in the project. So briefly, the project is organised into 4 different research work streams, and my colleagues will go into these in a bit more detail in just a second. But as an overview, we want to build the medtech evidence base. So this is building up the evidence to demonstrate the business case for implementing circular innovation in practice. We're going to be using a range of different methods to do this, including sensorization and simulation, some of the techniques that have been used in other sectors that we'll be applying to the medtech sector for the first time. We're looking at how we can use digital technology to enable the delivery of circular innovation solutions in practice and within healthcare settings. And then we're also going to be taking a whole system approach to adoption. So none of this would be possible without considering that wider system and some of those factors that are going to be necessary to address. And then, as I mentioned, we're really lucky to be supported by lots of different stakeholders from across the healthcare sector. And so we'll be engaging with those stakeholders at each stage of the research. So this is our theory of change, very academic, but really the purpose of our theory of change is to demonstrate that actually it's really important that our research leads to long-term outcomes and impact. We'll definitely be producing outputs. I'm sure we'll be producing journal papers and policy papers as part of the research. But really what we want to achieve is the demonstration and the uptake of some of this research in practice. So some of the impacts that we'll be looking to achieve in the 3 years and beyond, because acknowledging that not all of this change is possible within just 3 years, is an increase in knowledge and understanding of circular innovation within healthcare, increase in policy standards and regulation to enable circular medtech in practice, and then leading to increased resilience of the medtech supply chain, and an increase in the number of medtech products that are actually being designed for circularity and that we're seeing circulating in practice. So there's some of the kind of longer term outcomes and impacts that we're hoping to see in the future. And so this is the immediate team for the project. So we have the team at Exeter, so Professor Peter Hopkinson, Dr. Jin Ding, Georgie Hopkins and Kate Frewer. We then have Dr. Oki Okuri, who's at Manchester, Professor Ronan Daly, and Dr. Dashant Sirivantam at the University of Cambridge. And then we have colleagues from the University of Sheffield, Professor Ashutosh Tiwari, Dr. Divya Tiwari, and Dr. Yuri Mayer. And many of these are on the call today, and you'll hear from them shortly. So just wanted to give a bit of context as well to the funding behind this programme. So EPSRC put out a call for projects that were at the interface of digital innovation and the circular economy, and they actually funded 9 projects across a variety of different sectors. So ours is the only one focusing on healthcare, but there's others that are focusing on different sectors and looking at different technologies. And then all of those projects are coordinated by a network, Digital Innovation in the Circular Economy, which we are actually leading at Exeter as well. So this is the DICE network, and we just wanted to flag this here because I think a really important part of the project is learning from other sectors and pulling in kind of best practice, looking at other technologies that are developing that we can then use within healthcare. And so you'll probably see some information circulated about the DICE network, which actually has a number of feasibility studies associated with it. So there's funding available to fund kind of smaller, innovative projects as seed funding. So I think that is just a brief overview of the project, and then I'm going to hand over to Peter, who's going to take us through workstream 1.
Okay, thanks, Fiona. Can I control these myself?
I don't think so, so it will be next slide.
Okay, great. I've got 5 minutes, everyone, so I've got 3 slides. So welcome. Fiona's given a very clear introduction to the programme as a whole. So workstream 1 is involving myself and Jin, who's on the call, and others in the team, but we're leading on it. And the aim of this, I guess, Fiona hinted at it, is we're trying to put the economy back into circular economy, and we're trying to find the evidence base for many of the claims that are made for the circular economy. Why isn't it happening bigger scale already? So what's missing? And we think one of the things that's missing is the economic case, even though there is plenty of evidence to show the economic case. So we're sort of we've shaped this work package to think about how do we analyze the hundreds of thousands of products that are purchased and used in the healthcare system in the UK and globally every day, every year. So the first thing we need to do is to have a taxonomic approach that enables us to understand the types of products so we don't get confused and daunted by the sheer complexity and numbers of products. A taxonomic structure, and I'll say something about this in the next slide that enables to understand clusters or portfolios of products that we can think about at a product scale, but also at a broader scale, so that we can aggregate results from the specific case up to the sort of the bigger national picture. Taxonomy is really important, and a taxonomy is also important in terms of how do we apply circular economy to those products? What are the types of interventions that we might be able to apply? Because different interventions will apply differentially to different types of products, and I'll say something about that in a minute. We're taking a case study approach, and I'll say something about that in a minute, because people find it easier, I think, to understand circular economy when we're talking about specifics around particular products or surgical procedures or patient pathways. So case studies are really important. We're looking to improve strategy. So from those individual cases and from the taxonomic approach, how would we apply and implement circular economy at organizational scale, at clinical scale? What does it mean to improve the circular economy outcomes for particular types of products? And we're undertaking scenario modeling. What we mean by that, we're looking into the future. Doing some what will the future look like in 5-10 years if we initiate and implement different types of circular economy interventions. So work package 1 will create an evidence base which is linked to work packages 2 and 3 and 4, which you'll hear about subsequently. So let's have a look at the taxonomic approach on the next slide. Now, there's different ways you can slice and dice products and their constituent materials. And what we want to do is make sure that we've got a spread of cases that have different characteristics which lend themselves differentially to circular economy. And this is illustrative. This is one way that we can think about it. And we've just given an example here. Supposing we had 7 different product examples, from an MRI scanner to an IV bag to a surgical gown. They've got different characteristics around, are they single use or longer use? Are they simple materials or complex, etc.? So we're looking at a long list of different products that we think are relevant and important to the NHS and to clinicians and to patients, and trying to compartmentalize them to make sure we've got a spread, but also that they figure in different ways in the prioritization by those different stakeholders in terms of things like sales volume, number of units, amount of waste, contribution to carbon emissions, etc. And we're in that process at the moment, and we can take some further discussion about that if we want. So next slide, please. And what do we mean by building the evidence base? Well, the way we think about it is we use a common, consistent stock flow model. We're trying to understand the stocks of products that are coming into the health system over time, and we're looking at the flows. So where are they used? How are they used? Where do they end up? How many of them end up in incineration, landfill? How many of them are reused? This is quite a complex graphic. This is a case study that we completed previously, which we're expanding at the moment. And this, believe it or not, is the stock flow of harmonic shears passing through the English NHS from 2019 through to 2023-24, which is when we were able to obtain data. What we then, when we talk about scenarios, we need to look into the future. What does the future look like for those products in terms of volumes and sales through to, let's say, for example, 2030? And what we're trying to do is understand how many, what are they used for, how much do they cost, how many of them end up being thrown away, how many of them are potentially already reused or remanufactured. And once we know some of the basic data around prices of new versus, let's say in this case, remanufactured, we can start to do some quite simple modeling to look at the potential for scaling up remanufacturing with those devices through time. And what does that mean in terms of cost savings, carbon savings, and other types of savings for the NHS. Next slide, please. And then finally, what do we mean by a scenario? Well, at this stage, this is a very simple example. For that same example there, we can define a scenario as low circular. What's happening currently? How many of those devices are currently being reused, or in another example, it might be being recycled or whatever. So we can understand that's the base case as of today. And then we can start to think about circular economy interventions, enhanced circular, circular plus. So these might be things that are possible today. That's enhanced circular. In this case example, it was supposing that you could increase the number of devices that are remanufactured compared to the base case. That's what we mean by that. Circular plus might be what might be achievable if we have digitally enabled interventions, greater understanding and transparency of tracking of these devices through time. What if we could increase the recovery rate? What if the ones that we recover are designed differently, so that when you get to the stage of reuse or repair, you reduce the loss rate? And once we have that base data, we can start to put some numbers to it, look at the what it means in impact, as Fiona said, outcomes and impact. What does it mean in terms of total demand? What does it mean in terms of carbon reduction? So that's me done. That's work package 1. Okay, so I'll pass on to Ash, I think.
Okay, thanks, Peter. I think we're actually passing over to Divya.
Sorry, Divya.
That's okay. If you're on the line, Divya. Oh, I don't think we can hear you. The joys of technology.
I'm happy to jump. Oh,
yes, we can hear you now, Divya. Thank you. Oh. We could hear Divya, but I think she's now frozen. So maybe Ronan.
Would you like me to jump ahead?
Yeah, we can go on to work stream 3. Yes, yeah? We can, Divya. But sorry. Oh, you were frozen for a second, but I think if we've got you back, then we'll go with work stream 2 then.
Okay. Thank you very much. Okay, so just a bit of motivation before I start talking about workstream 2. Currently, the medtech sector in the UK has an annual turnover of 27.6 billion and a diverse area of 500,000 medical products. However, due to the vast number of medtech devices in circulation, with different lifespans, levels of complexity, volume, and value, there is a lack of clarity regarding which method of circular innovation is the most optimal and at what time during a product's life cycle. And the complexity is the scarcity of usable data concerning the condition, availability, location, and usage of in-service medtech products, along with the diversity in design, materials, and wear patterns, hinder the decision and timing of CE interventions. Therefore, the work stream, our work package here we are discussing, we are focusing on sensorization and simulation. So our approach proposes that with the advances in real-time analytics and simulation techniques, which has been demonstrated by our team in other sectors such as aerospace and automotive, we can apply these advances to a portfolio of medtech use cases to identify the optimal CE intervention for the right device at the right time for an optimal outcome. This will involve developing assessment tools, balancing the cost, environmental impact, and social benefits. The overall goal is to extend products' life, retain critical materials, and support better decision-making in healthcare. Next slide, please. Thank you. So the first step is to capture the research landscape and identify the gaps. We are doing this by 2 methods. We are talking to industry, so data collection from industry, where we are talking to surveying healthcare professionals and product manufacturers from both non-healthcare and healthcare sectors. We also plan to talk to the external and regulatory bodies and customers. We are also capturing the research landscape by doing a thorough literature review. Here, we are conducting a literature review to capture the key findings, and we are capturing it in the form of a chart that shows some descriptive variables on key topics. Next slide, please, Georgie. Thank you. So a bit of background on what we have been searching in terms of literature review. So when we looked for sensors and simulation to support circular practices in healthcare, at the intersection of medtech, sensors, and circular economy, the key research areas that came up are Lean 4.0 in healthcare, that talks about reducing waste, but faces technical integration challenges, circular design for medical devices, that focuses on the reuse, remanufacture, and design recommendations, IoT-enabled supply chains, green operating theaters. Digital twin is an area that has been heavily researched, and medical textile recycling. At the intersection of medical technology, simulation, and circular economy, so here we are looking at simulation models to support circular practices in healthcare. The key research areas we found are AI-driven simulation models that simulate that talks about simulating product life cycle and treatment to support circular processes. Life cycle co-simulation, impact simulation of circular interventions. Next slide, please, Georgie. Okay, so looking at the literature now, our immediate next steps are, we aim to develop a sensorized workbench using sensors to track product, material, and waste flows. This will capture data on usage frequency, condition, and availability. Our immediate next task would be to create data-driven simulation models to access impact across 3 scenarios. So we will have 3 scenarios, like baseline scenario, a sensorized environment scenario, and sensorized products, plus the environment. These real use cases will evaluate how sensor data informs decision-making, and we will collaborate with other work packages for the choice of right use cases that we can model. And finally, we plan to optimize our simulation models by using optimization algorithms to determine ideal timing for C interventions. This will allow us to improve the allocation, sharing, and recovery of medtech devices. So the key objectives will include reducing costs and emissions, increase efficiency, and enhance patient outcomes. So that's all from work stream 2. Back to you, Fiona.
Great, thank you very much.
Over to Ronan.
Thank you very much. So I'm here with Dushanth, and together we're with Peter. We're working on this work stream 3. So just a reminder, because I know we're throwing a lot at you. There is, all of these work streams are running in parallel and working closely together. So you're just getting a flavor of each. And in this one, we're looking at the digital technology part. And so I'll explain what that means. And so over the course of those 3 years, we're going to start by mapping what digital technologies are out there, are being used, but also emerging technologies that have not yet been thought about and used for circular economies. We'll move on to then looking at the in-hospital learning. So if you remember that first diagram you saw from Fiona, there's the reuse, and there's remanufacturing, and there's regeneration. And there's a lot of systems we need to understand in the hospital to then think about what technologies will make that feasible and easy. And then we have to think about what real technology case studies we're going to do and support that, getting digital technology trials right by the end. So that's what we're going to be doing. If we go to the next slide, and it might help just put some flavor to that. So when we're talking about these technologies and we're talking about digital technology, we're trying to get information. So this is just to give you a suggestion of the kind of information that if you have medical devices, and this is just an example, then you'd want to collect data to enable this reuse and this circularity. You're going to want to know the manufacturer, you're going to know its history, and you want to know all the different components and knowing what's reusable, what's recyclable towards the end of life. And in the next slide, you might then also want to know, you'll definitely want to know, as you look to reuse things, having that data tracked, that it has gone through all of these cleaning steps, sterilization checks and tests, and then whatever function that device has, you've tested that function and you know it works. And so there's all of these additional steps that already happen with a new device, but we're going to have to do and somehow integrate again with remanufacturing. All of that data has to be collected to enable decisions. So it's how do we collect that data? And then in the next slide, so that reuse is really happening in the hospital at that use stage on that diagram, right in the middle. You then decide, are these devices going to be, are they designed for reuse? Are they single use? And they'll suddenly have to go down different tracks. They'll have different tests. They'll have different maintenance or inspection. And you have different decisions being made before they eventually end up in a waste stream. And we're looking at how to make them circular and what's needed. So our part is saying, well, what digital technologies are needed where, and how do we trial those to give the information required to say whether or not things can be reused or disposed of. So really, finally, just to give you a flavor of what we're doing right now, the very first step, just like in the other work streams, we're building up our knowledge of what's out there. So we are reviewing all of the different things being done for circularity in other sectors and what digital technologies are being used to help with circularity elsewhere. Healthcare has its own significant challenges, but it doesn't mean we can't learn from what else is out there. And then we've also moved on to look at all of the comparisons out there between single use and multi-use as other people beyond us are thinking about shifting to reusing single use devices. And all of this leads up to us being able to identify what information is the world using to make these comparisons, because those are the kinds of things we need to be able to measure and use to make decisions in the future. So we're reviewing it, but specifically to learn what digital technologies may be needed, and where they don't exist, then this project is going to develop them and put them out there. So that's the first stage. That's what we're doing right at this minute before moving on to those other stages I mentioned. So I think with that, I can hand over back to you, Fiona. I think the next stage is with you in Workstream 4.
Great, thanks so much, Ronan. And Workstream 4 really is about that whole system adoption and the fact that obviously all of this, technology, this change, this innovation is definitely not going to be possible without a number of different factors, such as very important clinical efficacy and safety, leadership and behavior. So what is that mindset shift? What is the behavior change that's going to be necessary? What are the different regulatory and policy changes that we'll need to see, as well as kind of the economic and value creation opportunities, system and product innovation, and kind of the infrastructure and facilities that are going to be necessary to enable circulation to happen. So Workstream 4 is really looking at this whole system adoption, and on the next slide, really taking those different scenarios that are going to be developed in work streams 1 to 3 and mapping those and involving the people that are actually going to be responsible for implementing them, that they're going to affect. So this work stream doesn't actually begin until next January, once the other work streams have had a chance to develop some of these scenarios. But really, we'll be looking at kind of what are those factors that are going to influence adoption. We'll be engaging with a number of different stakeholders through interviews and observations within healthcare environments to really look at those devices that we're selecting being used in practice by clinicians, coming into contact with patients. And we're also going to be integrating views and perspectives of regulators, of policymakers, so that we can really get that whole system understanding of what those scenarios look like. So moving towards the end of this work stream, we'll be seeing a number of co-created scenarios and circular business models that really give a much better picture of what digitally enabled circular healthcare innovations can look like in practice, and the recommendations that we'll be making at the end of the project. So that was a bit of a whistle-stop tour of DECHI. Obviously, we're, as I mentioned, engaging with lots of different stakeholders, but we're really keen to bring on board more partners, more stakeholders who are interested in collaborating with us, particularly around these scenarios, around the use cases that we're going to be selecting. So please, if this is of interest to you and you'd like to collaborate, do get in touch with us through the links on this page. And I'm now delighted to be able to hand over to Josh, who is from DHSC, and he's going to give us a bit of an update on the Design for Life programme. Thanks, Josh.
Thanks, Fiona. Yeah, hi everyone. Thank you for inviting me to come along and give you an update on Design for Life. And also just great to hear the range of work going on in DECHI. And I think, as I'll come on to, I think there's lots of areas where this will support our programme too. So yeah, that's it. So I'm going to start by just talking you through the range of work within the programme and a quick kind of recap. So Design for Life is the government's programme to build a circular economy for medical products by 2045. We published our roadmap in October last year, and the roadmap was set out into 6 sort of key, what we call problem statements, sort of the key barriers to achieving that vision by 2045, and a path of 30 actions to address those challenges and deliver the change we want to see. So you can see it's sort of a really wide range of challenges from the sort of leadership and governance. So sort of how do we embed the culture of a circular economy within the NHS and within leadership structures, to regulations and standards, and yeah, how we can sort of open up and change the sort of commercial, the sort of market conditions to support circular business models and things. So yeah, wide range of activity. I think that the work stream that I wanted to highlight is our physical and digital infrastructure one, which I think is perhaps where the most sort of obvious direct link to some of the work that you're doing on the DECHI programme comes in. So one example, I think, just hearing what you were talking about there, Ronan, on the idea of a digital product passport, or the sort of the way in which devices can be tracked through the system, is a solution that we're sort of aware could really unlock the potential of reuse, and then also I think a lot of these technologies will be helpful in decontamination and things like reverse supply chain. So how can we sort devices out that are being collected and potentially sent off for different kinds of materials recovery or remanufacture, etc. So that's the sort of the main area where I see this crossover with DECHI. But then there are lots of other areas that I think that will benefit from your research as well. So I'll sort of come on the next slide to just talk through some of the highlights of the work we're doing at the moment. Now I'm not conscious I've only got a few minutes, and this is a very busy slide, so I'm not gonna try and sort of talk through everything on here. But this is essentially a sort of map of our current activity. I mentioned we've got 30 actions in the roadmap to deliver the Design for Life vision, and of those 30, I think we've worked out we've got about 20 of them sort of underway or started in some way, and they're sort of flagged on here. So we're making great progress, but as with anything, we're sort of accumulating more projects and more work as we go, which is exciting as well. So I think just to start working through on the governance and engagement side, we've relaunched our advisory group last week, and Fiona, you're kindly representing Exeter and the wider circular economy sort of research space on that group, which is really helpful, and that will be the primary sort of decision-making engine for the programme. And we've got our priority should say priority adoption working group established. So that's the first of sort of 6 working groups that will be tackling some of the challenges that I sort of showed in the last slide. And this first one is really, what can we do in the short term? So what are the barriers to accelerating adoption of circular products that are on the market now? And we know there's lots of great work going on now in trusts and across the system, NHS supply chain and elsewhere, to drive adoption. So we want to coordinate that work and look at sort of how we can go further. And I'm immediately seeing some links with your workstream 4 that you talked through, Fiona, in terms of how we assess and tackle some of those adoption barriers. So then, looking at real-world testing, we've commissioned a series of pilots which have now reported and should be published soon, from the Centre for Sustainable Healthcare, in collaboration with Brighton and Sussex Medical School. So there were 7 products, like across a range of sort of complexity, from slide sheets to bronchoscopes and various things in between, which has given us a great sort of body of evidence on in terms of case studies and benefits, but also like what are the barriers that are being experienced on the ground. So that will be helpful when we've published that, and it's giving us a lot of useful evidence to sort of work with. Then on the research side, I think the first one to mention, which I think has got a close and sort of immediate link to perhaps to DECHI, but also wider Exeter research programme, is our material flows work stream. So that's really looking at how can we understand the materials that are coming into the NHS in the form of medtech products, what the volume of those materials is, what they might be worth, and how we might go about recovering those materials, or a higher proportion of them. So that's an exciting project we're working together on. And then the last one I wanted to flag is I think there are 1 or 2 sort of tiles on the slide relating to this, but our decontamination survey and decontamination sort of framework. So we've got sort of 3 bits of research that we want to do this year to understand the current sort of provision of sterile services and laundry and sterile laundry, and what we're calling decontamination as a sort of umbrella term. And so those 3 pieces of research are all going to go towards developing a strategy for how we could expand sterile services provision across the NHS in the coming years. So the first thing is just understanding current capacity. I think there hasn't been a full capacity survey of sterile services provision in the NHS for decades. I think, yeah, we've got about 20 years, I think, was the last time anything like that was done and was published. So that's something we want to do this year. Then there's some demand modelling, which I think crosses over with some of the work streams that you've talked through, in terms of understanding where which products are going to be decontaminated in a way that's not just at the point of care, that actually requires those sterile services departments, or laundry, and so on, and therefore what can we expect demand to look like as we get further into the next sort of 2 decades before our 2045 target. And then lastly, the service models. So what models are those services provided on at the moment, and what technologies are emerging that might sort of change the way in which sterile services can be provided. So those are the sort of 3 areas of research that we're taking on this year, with a view to then being ready to sort of develop that decontamination strategy next year. So those are the sort of the things that I wanted to highlight. But yeah, there's obviously a huge amount more that we can talk about offline. But yeah, do raise any questions, I guess, at the end when we have a Q&A, and look forward to hearing more about the programme.
Thanks ever so much, Josh. Really great to see kind of how much the Design for Life initiative and roadmap is covering, and also fantastic to see so much progress with so many of those actions. So lots going on. And I'm sure there'll be lots of questions for you at the end. So now moving on to Daniel Cool, who is going to talk to us about the work that's being done at Surgical Holdings, and provide us with an industrial perspective of some circular innovation in practice. So over to you. Thank you, Daniel.
Thank you very much, and good afternoon to everyone. Appreciate I haven't got much time and I've got a lot of slides. I don't know, am I able to navigate this? Oh, I can, that's good. So yeah, I'm just going to whiz through, as Fiona says, some examples of some circular economy work that we've been doing in relation to our business. So we're a manufacturer and repairer of surgical instruments, rigid endoscopes, power tools, other medical devices as well. So we employ 60 people and we're based in Southend. Actually, funny enough, we do a lot of our work across the NHS, but we're also seeing quite a demand outside of the UK. So export markets in the Middle East that are coming to us for repair of goods. So this is why we want to be maintaining surgical instruments. So this is a surgical punch, spinal punch that was in use, and this is typical of what we see that comes into our business, and we have to then repair these. But obviously, with regular maintenance, this sort of thing doesn't occur. I won't waste time on this one because we all know what the circular economy is, of course, a lot of experts on the call, but this is where repair and reuse fits in the circular economy model. And obviously that's where we're coming in from the service that we offer. This is really just probably the main and most important slide to show, and this is a orthopedic mallet. Again, typically what we see on surgical sets that are out there in use. This is a good example of mallet because it's got a big surface area on it, lots of chips and dents and marks and missing bits of metal, but utilising the skill we have in-house, we're able to completely refinish these devices and make them as good as new. And obviously then, quite often these devices are being used for sort of 20 years or so, so they can obviously go back into the set. Always get really good feedback from the surgical teams. They think they've got new devices, and of course we've saved a lot of money in the process, which I'm going to tell you about as well. But a lot of people think refurbishment is just repairing the device. We're really, because you're working with stainless steel, we can regrind and refinish the surface of the steel, taking it back to a really sort of ultra fine, ultra smooth surface, which obviously helps with things like corrosion resistance on the devices, which are a big issue. And this actually comes from some work we did many years ago when we first started doing refurbishment of surgical sets. We actually I'm just going to skip forward and just to show you a better summary. We did this project with a particular hospital. They had 138 sets, over 6,500 instruments, which we completely refurbished for them over a sort of managed period. And that's what a lot of hospitals are doing. They're trying to start to do refurbishment on devices over a set period rather than trying to do it, through unrealistic timescales. But we saved over £90,000 and estimated carbon savings of around sort of 4,000 kilograms based on current data that's out there. So it's a tremendous impact in that respect. What we found though on this journey is obviously there's a lot of other challenges out there when you're looking at repairs, and quality of repair is one of those. And we're an OEM, we're a manufacturer. And we see some really disastrous attempts at repairing devices. So we came up with this ICE acronym. So we when we're talking to customers we deal with, this is what we try and preach, that devices should be, if they're having devices repaired, they should be inspected. They should challenge who's actually doing this work, the credibility and the training that these technicians have, and also then evaluating the repairs that are carried out through discussions with clinical teams. And this is really vital, because what we don't want is to see a big drive to sustainability and resulting in poorer quality instruments and poor quality repair work. So this is an important thing to remember. So this is just to show an example. I don't know if this is going to come through. This is a really expensive plastic surgery scissor, and this is an example of a poor quality repair that we've seen in field, which won't do the required job for the patient or the surgeon. And this is what it should look like. I'm just conscious of time. I'll just skip on a couple of more slides. So we're trying to move forward and be innovative with our repair work, and we have our own software, SurgiFix. It's an online portal, so our hospitals log their information as to what is coming out to us to repair. We can then model this, and they have an online portal that they can go on and run reports and trend. And ultimately, the output of this that we promote is that we can obviously look at and identify the items that are breaking down the most, and then provide training. So we've got CPD accredited training that we can then work with hospitals and obviously look to reduce down the damage, because ultimately we want to be reducing the need to repair devices. Promoting things like maintenance, just oiling and oiling instruments will keep them working. So there's no need to repair them if you actually look after them in the first place in the correct way. And these are things, the simple things that get missed, that we remind people of. Training and training materials like this, how to care for devices. We have an instrument recycling program for our customers. They put any instruments that have been reprocessed, sterilised in there that aren't used, and we can recycle them, or we can donate them to charities we work with. And just preventative, so putting instruments in an organised fashion into sets means that you won't have unnecessary damage. So very, very quick run through those slides, Fiona, so I hope that's okay.
That's great, Daniel. Really appreciate that, and fantastic to see this in practice, and also to touch on the software that you're using, so highlighting where digital technology is making a difference to your organisation. So that's brilliant. We've now got just over 10 minutes time for questions and answers. So please do either pop your questions in the chat, or feel free to raise your hand and come and ask your question live. It'd be nice to see some faces and hear some of the voices. I do have a question for Daniel. So while everyone else is thinking about their questions, I was just building on the point that I just made, really, around kind of digital technology. Obviously, that's one of the aims of DECHI, sort of how we can use advances in digital technology to enable the better kind of more adoption of circularity in practice. From your perspective, Daniel, and your business, what types of innovations are you seeing, or what have you given any thought to the types of digital technologies that would be useful to help your business?
I think, well, adoption of platforms like ours is important, and I think that there's a couple of other products out there, but quite often maintenance and repair is very reactive. So I think it's trying to encourage hospitals to take an overarching viewpoint of it and actually analyse the data. But I think the challenge has been that so often the time isn't there to actually do that and to step back, because potentially we're repairing devices that actually, with a bit of training and foresight, wouldn't need to be repaired or improve handling. So I think my view, obviously from a technology perspective, if somehow we could be looking at circular economy software that helps promote training or can deliver training and actually adds to that, then I think that's a really big thing. And that's time and time again we see that's not in place, and it's just reactive, which is a waste of money.
Yeah, great. And I think that probably picks up on the point you were making, Josh, about kind of digital product passports, and actually if they can get to a stage where they're preventing that maintenance and repair from needing to happen in the first place, that's what we should be aiming for.
Yeah.
We've got a couple of questions. So I've got one from Rashmi and then one from Faye.
Hi, can I go ahead?
Yes, please do.
Yeah. Hi, sorry I joined late because I had not received the link earlier and I was struggling to find the link for the meeting. But yeah, thank you so much. I did actually pop my question in the chat as well, because I'm a community partner in digital health with the Imperial Biomedical Research Center, and I know they have been exploring this as well. So is this project also linked with them, or would it be useful to connect you to them? I mean, in case they are wanting to move ahead.
Yeah, thanks, Rashmi. So we are connected. I know that there's quite a few other centres and projects going on, and we are trying to, where possible, link with those, because obviously we don't want to repeat anything. We want to be building on other research. So yeah, I'm not sure across the rest of the partners on the call, but I think we'd really appreciate a link to those at Imperial. Thank you, Rashmi.
Okay, yeah, absolutely. And my one question was to Daniel, actually. I know when you refurbish the instruments, I mean, I would assume that there is a sterilization process and they are safe to use, the instruments.
Yeah, well, our devices that we handle are all reusable anyway, so they would only come to us with a decontamination certificate. So
Okay.
yeah, that would be the case. Having said that, the challenge is when we've started to, as I mentioned, the Middle East and working with, you then really have to put in processes. We have an in-house washer, disinfector, and sterilizer, so we have those processes in place. Should there be a question mark around the decontamination certificate, but that's something also to consider.
Sure. Thank you. Thanks, Daniel.
No
Thank you.
worries.
Great. Thanks for your question, Rashmi. Faye.
Hi, thanks. I've got a couple of questions, but I'll try and keep it brief rather than taking anybody's time. I think it was in work package 2 that it was talked about discussing with industry and with healthcare professionals. But I wondered if you had considered also discussing with patients. There are a lot of devices, med tech and everything like that is transferred to the patient for them to take home, whether that's crutches, boots, chairs, devices, and whether there is kind of scope on the circular economy around that social health kind of side, or if the focus is very primarily set on the hospital space.
Yeah, thanks, Faye. And this is actually a really pertinent discussion that we had when we were developing the proposal, and we were really keen to include that aspect, however cognizant that we can't do everything in 3 years. But I think there's definitely scope to include at least 1 or 2 devices within our selection of those different medtech devices that does move between different environments. So perhaps a medical device that is used in the home, because we're really keen to see those different characteristics, different factors that need to be considered to build up that whole picture. So I think, yeah, we didn't write it in, but we'd definitely like to include it, I think, if time allows.
Yeah, no, that's great. And just one other that I'll do. So obviously, like companies like Daniel's are like well on board and see scope for making money, I guess, off making these circular economies. When you've spoken to other companies, manufacturers, do they see this as a potential threat to their bottom line, or do they see this as a way or another avenue for them to keep working and to keep making money in different avenues?
Yeah, thanks, Faye. Josh, I don't know whether you've got a perspective on that.
Sorry, Faye, I'm really sorry. I was just in the process of typing a comment into the chat for your previous question. I've missed your current question. Sorry, could you repeat it for
No,
me?
absolutely fine. It was about if you've had any initial conversations with companies as to how they perceive this circular economy in relation to their bottom line, whether they see it as a threat or a potential to diversify their avenues.
Yeah, absolutely. So, I mean, I think it's a mixture of the two. I think we do see. I mean, we're conscious that, and often it's the sort of the elephant in the room in our discussions with industry, but that single-use sort of business models obviously are profitable, and it's difficult, and for a variety of reasons, the NHS has obviously adapted to a single-use model. So it is difficult, and there obviously is resistance and concern around moving to models that will disrupt that profitability. But there is also a lot of innovation going on, and I think one of the sort of pieces of work we're doing at the moment is a sort of bit of market research to understand where reusable products are coming onto the market, what is the profile of the companies that are introducing those, and it does seem to be that it's more often SMEs who are kind of innovating in the space of designing reusables, but I guess not always. So it's a mixed picture, and I think the biggest challenge that we get back from industry as to why why this is challenging is that we have to ensure that if industry develops a circular product, that the NHS will buy it, and that's obviously where our procurement levers and things like value-based procurement come in to make sure we can give that sort of strong demand signal to industry that's what the NHS is looking for. I might as well, if I could just very quickly come back on your other point, just to mention that we are looking at medtech in the community as part of the Design for Life programme. It's not just because of the fact that the majority of the spend and the volumes is sort of coming from secondary care. That tends to be where we're focused. But there is a thing called the Part 9 tariff. I don't know how familiar people are with that, but that's sort of where products are selected to be prescribed to patients through pharmacies and so on. And that tariff is under review by DHSC, and we're feeding in circular economy criteria into that process so that we're aiming to reward products that have those circular credentials, so that they have that advantage. Again, it's the procurement point about how we bake these things in. But sorry, I've spoken for a lot there.
That's so helpful. Thank you.
No worries. And Daniel, I don't know whether is your hand up to respond to that question?
It was more like, it was just to say, we see that obviously in the marketplace that there's some resistance to that, but I mean, I think, we're launching a new scope hopefully by the end of this year, and we're looking at like an open source model where, if we can provide things like the jigs and the know-how of how to repair it, and actually we can control that, we'd be happy to put that out there. So just trying to change the mindset on that. I think a lot of manufacturers are justified in being wary of sort of things like repairs of their devices because of the quality side of things, like I've shown, like we don't want to go down that road. So I think as long as there's awareness of that.
Great, thank you. Lawrence?
Just a quickie. In other industries, I've seen people using a package called KNIME, K-N-I-M-E. Is anybody in this field using it? It's very powerful. You can, to begin with, you can use it on a PC free of charge. Just download it and use it. But if you want to get really big and international and so on, you go to their server version and you pay for it. I found it incredibly powerful. It's almost entirely replaced SPSS in my own research over the last 3 years. Do you know of anybody who's using it? KNIME.
No, I don't, Lawrence, but if you can put a link in the chat, that would be great, and then we can go and have a look at it. Brilliant. Thank you very much. I'm conscious we're running out of time, so we're not going to unfortunately be able to get to everyone's questions, but I do want to finish on a question for you, Josh, that's in the chat, which I think is particularly meaty. So question from Ian: will this project and DFL put the UK NHS in a leading position worldwide? Which other countries are doing anything like this?
Yeah, it's a really good question. Thank you. And I think the way that we framed the roadmap is very much that this is a first of its kind in the world as a sort of government commitment to delivering a circular economy for healthcare. And I think it is in the sense of having a sort of very thorough plan for how we deliver that and a clear target. I think but there are also in different areas of this a lot of other countries where they're sort of further ahead in adoption of reusables. And I know we're actually talking. I've got a colleague in the MedTech Directorate who's out in India at the moment, and we know that reuse is just done as a matter of course in a lot of cases, because for various reasons the system hasn't sort of disinvested in sterile services and that kind of thing in the way that we have, and we've got used to single use as a model. So there are, and then with just close to home in Europe, we know colleagues in the Netherlands have sort of been pioneering in terms of developing a list of products that they want to swap in for circular alternatives. And I think I can think of sort of a wide range of other areas where I think there are a lot of other countries that are sort of further ahead in one or other aspect of the programme. But I think we like to think we're, in terms of bringing everything together, we're sort of getting out ahead, and I think time will tell as we deliver on it whether we maintain that leadership position, but I hope we can.
Great. Thanks very much, Josh. I think that's a really nice point to end on and give us all hope for the future. And it's very exciting to be working in this space. Thank you so much for all of your other questions. And sorry that we've run out of time to get to them all. But there are a few links in the chat box. If you do want to stay in touch with the DECHI project, please do click the link to fill in that very short form so that we can add you to our database so that we can update you on any future activities. We are going to be running several webinars as part of the DECHI project, both to update you on our progress, but also to bring in other speakers. If you'd like to be a guest speaker, please do get in touch, or any recommendations of topics that you'd like us to cover. And also please do follow us on LinkedIn. But thank you so much for all of your engagement, and thank you to our fantastic speakers, and look forward to engaging with you all over the coming 3 years. So thank you very much, and have a lovely afternoon.
Thanks, bye.
Thanks. Thank you, bye.
Thanks all.
Thank you.
Thanks, bye.